Hello and welcome to Public Report. I'm your host, Desiree Horde. Our guest today is Kathy Clements from Beaver Dam Community Hospital, where she is a Hillside Hospice social worker. Our issue today is health and our topic, advanced care planning. Kathy, it's nice to have you on the program today.
Thank you for having me.
Why don't you tell us a little bit about yourself and also your work as a social worker with Hillside Hospice?
Well, I have been a social worker for 17 years. I've been in the healthcare field for over 20 years, and specifically with Hillside Hospice for a little over 4 years now. And as a social worker for Hillside Hospice, I support families in non-medical areas. I'll go in and we'll touch base on legal, financial, emotional, and social issues.
Okay. And you just mentioned briefly some of the services that you offer. Can you explain to us what is hospice care?
Hospice, in a nutshell, hospice care is end-of-life care. So as a hospice team, we focus on supporting people who are facing end-of-life and their families during that time.
Now tell me what hospice is not.
Oh, thank you for asking that. Hospice does not focus or have a philosophy on death.
Okay.
We really focus on life and making the final days or months or even a year, we've had many people on for over a year, making those days filled with comfort, hope, and quality of life. That is really our focus.
Mm-hmm. What is advanced care planning?
Advanced care planning is making a plan for the type of health care you want or don't want in the event you can't speak for yourself.
Okay, and tell me, why is that important to plan for the future for your health care?
Oh, it's very important. Planning for the future helps not only yourself to enable you to ensure that you get the kind of health care you want or don't get the health care you don't want, but it also helps your family. So when you're faced with an unexpected illness or injury that you could be facing death, having that plan in place makes those things go much smoother for yourself and the healthcare community and specifically your family.
Okay. And what is an advance directive?
An advance directive, and which is also known as a power of attorney for healthcare document, is a legal document in which you are stating your wishes for end-of-life care, or in the event you had a life-threatening illness, the type of health care you want or don't want. And the advance directive is a little different from a living will. Advance directives and power of attorney for healthcare documents are documents that you're naming an agent, somebody close to you, hopefully, a relative. Spouses will sometimes name each other or their children to speak for you in the event you can't speak for yourself. A living will is a declaration to a physician about your wishes, but it does not designate an agent. So when designating an agent or thinking about who would I want speaking for me if something happened to me and I could not make my own decisions, you want to think about who would follow your wishes. And knowing that just by filling this document out, you're not giving up control of your health care. That's an important point. You're always in control of your health care as long as you can knowingly make and communicate your decisions, your health care wishes.
Now, what is the purpose of having a legal document?
Many people think, well, I've told my family my wishes.
Right.
You know, they know. Well, that's fine and good unless something happens and somebody contests what your wishes might have been. Nobody will know. Nobody will know what your wishes were unless you had them down on paper in a legal document. And this just ensures that you'll get the kind of health care you want. And it ensures your family to know, so there's no second guessing. Being an agent is tough, because if you're faced with decisions about life and death, you want to know, what would my loved one want? And so you're doing your family a favor by doing this.
And what documents are part of the advance directive?
The advance directive is a single document in itself. So it's a document that will ask you questions regarding care in a nursing home or an assisted living? Do you want IV hydration? What about resuscitation? Do you want your heart started if it stopped? So it is a complete document in itself, and it doesn't have any adjoining documents with it.
And would someone need an attorney to fill out this type of document?
No, not with the healthcare power of attorney for healthcare advance directive. You do not need an attorney. It's a fairly straightforward document, and not always easy to fill out because it makes you think.
Exactly.
It makes you think.
Exactly.
But what makes the document legal is your signature being witnessed by 2 witnesses. And it's important to remember that the witnesses cannot be family members or healthcare workers. So you can take it to a bank. It does not need to be notarized. Okay. You can take it to your neighbors or have your friends come over one night and say, you know, we're filling this document out. Would you be our witnesses to this document? And make sure that the witnesses sign the document on the same day that you sign the document. I've already come across a document where it was signed by the principal, who would be you, but their witnesses signed on different dates or put down different dates. Well, that can nullify that document.
Okay. What types of healthcare decisions can come up as someone gets closer to dying?
Life-prolonging decisions. We have a lot of medical technology that can prolong in life. Doesn't always mean you have quality of life. So life-prolonging medical interventions would include breathing tubes, tube feeding, IV hydration. There's some treatments, chemo, there's dialysis.
How can someone start considering what they would want to be in their advanced care planning?
I would recommend to start by obtaining a document.
Okay.
Get a power of attorney for healthcare document or advance directive. These are state-specific documents, so if you're spending time in 2 states, get one for each state. Okay. And then take a look at the document. For a long time, I taught people on the importance of filling out a document, and then when it came time for me to fill it out, it caused me to think. It caused me to think about, what do I want? And I think the thing to remember when filling out that document are a couple things. You're not giving up control. You're always in control of your own health care as long as you can make those decisions. And the health care that you're talking about is health care during a time when you have, or if you have, sustained a life-threatening injury or illness. At that time, what kind of health care do you want at that time or don't want? Right.
What is a health care proxy?
That is the agent, the person that you're naming to speak for you. For myself, I have my husband is number 1 and my son is number 2. You can have up to 3. We had one gentleman that I know of had 9 children and wanted all of his children involved.
I see.
So it's really your document. You get to say what you want. And it's important to communicate that to your family. I cannot stress enough the importance of that. I was a power of attorney for health care agent for my mother. And she did sustain a life-threatening illness and needed emergency surgery. She was able to say that she wanted the surgery, but after surgery, her health care became more life-prolonging and sustaining without quality of life. And I knew that that is not what she wanted. So we were faced with the decision to say, stop the life-prolonging treatments and let her die the natural death that she would have wanted, because she didn't want all the treatments that were starting to occur. So having that personal experience really has taught me the importance of communicating your wishes with your family, making them known, getting them down on paper, because now after we took my mother off of the life support, she died that next morning. I know now that we did what she wanted to do. What she wanted us to do. I don't have to second guess myself or wonder, did I do the right thing? And that's tough on families, because when you're facing life and death, it's highly emotional. So having a document that your loved one filled out and gave you specific information on what to do or what not to do makes all the difference in the world. It is very helpful. So please communicate your wishes in writing, verbally, and then revisit those documents. We recommend that everybody over the age of 18 fill out a document. Well, from 18 to 80, there's a lot of life changes. So revisit that document and make changes.
And is it easy to make changes? Can you make those kind of changes?
Yes.
Even though it's a legal document?
Yes, and it's actually quite easy. The way you make the changes is by filling out a new document.
Okay.
So make the changes, fill out the new document, and then again, have your signature witnessed by 2 witnesses. And then make sure that your agent, the people that you name to speak for you in the event you can't speak, make sure they get a copy, your healthcare provider gets a copy, you have a couple copies, so that if something happened unexpectedly and you're in the hospital staff are going to ask, does she have a power of attorney for healthcare or an advance directive? And your loved ones can say, yes, she does.
Where can people get help just even in making end-of-life decisions? What you think at age 18 might be very different than what you think at age 40.
I would recommend starting out by getting the document and taking a look at it. That causes you to think about, okay, what do I want? And when thinking about it, remember that it's not necessarily right now, but it's in the event that I have incurred an injury or an illness where now I can no longer speak. And what is that going to look like, and how do I want to live out the rest of my life or not? So I would start out with thinking about the questions that you're being asked on that document. And if you have questions and you're just not sure, speaking to your loved ones about it, speaking to your healthcare provider, speaking to your pastor. Sometimes there's some spiritual connotations that people have questions about. So I would recommend talking to your pastor about that. You know, when my mom was in the hospital, she had a tree, literally a tree of IVs. There had to be 7 or 10 IVs going into her, along with the breathing machine and the dialysis. And I'm looking at that and I'm thinking, this is not how she wanted. And personally, I got my strength at that time. I prayed about that. And what I realized was, for those that have spiritual concerns, I realized at that time that God is not intimidated nor are his plans thwarted by our medical technology. He doesn't all of a sudden go, oh, I didn't know they were going to have that machine to keep her alive. Okay, so that helped me to know that. I prayed about it, so I would recommend for those that rely on prayer to pray about those decisions too, and just know that God's will be done.
Now, just kind of in closing here, thinking about as we're talking with our families about these things, I'm thinking about when children are involved, and specifically maybe even younger children sometimes that might come in to play. How important is it to keep children informed of the decisions that are being made?
I think it's really important to keep them informed honestly and speak to them at a level that they can understand, and stay away from euphemisms. Okay, it's as honest as you can be. Include them, because death is a natural part of life, as well as being born. Illness, injuries, they occur. And I think for children, we can actually learn a lot from children by allowing them to participate with us in that event. And sometimes they just keep us sane through it.
Right. Well, Kathy, I appreciate you so much being on the show today. It's been very informative.
Thank you for having me. I appreciate it.
Thank you. We've been speaking with Kathy Clements from Beaver Dam Community Hospital, where she's a Hillside Hospice social worker. Our issue has been health, and our topic, advanced care planning. Thank you for viewing Public Report.
I hope you never have to experience what I had to experience today. What I'm experiencing right now. My hands, they're shaking. My heart is about to explode. I'm scared. I know I did something wrong, something terrible. Now I have to face the consequences. My life will never be the same, and all because of a stupid text.
This video was submitted by a student through the Teens Drive Smart program. For more information on teen safety, visit teensdrivesmart.com.
After leaving the military, some veterans may face homelessness, but they aren't alone in the battle. Thanks to a simple phone call, they can get help from a trained professional at VA. If you know of or are a veteran in need, call 877-424-3838.
And welcome back to Public Report. And for this segment, our guest is Dennis Richards, and he is the Hillside Hospice Chaplain. Our issue is health, and our topic for this segment is grief support. Chaplain Richards, it's nice to have you on the program.
It's great to be with you. Thank you.
Tell us about yourself and your position as the Hillside Hospice Chaplain.
I was a pastor in California for 13 years. And so I was in ministry and was already involved in dealing with bereavement, dealing with life and death matters. And so when we moved back to Wisconsin, it just was a natural transition into being a chaplain. So I'm excited for the opportunity to work with Hillside Hospice in that regard. And so I have the opportunity to reach out to families when they're often most vulnerable, often hurting and in need. And it's just been a great experience.
What are the advantages of a hospice worker being both a chaplain and also a bereavement counselor?
Being a chaplain and bereavement counselor allows you to naturally transition as the patient is dying, the loved one is dying, and then after their death. My desire is to bring them comfort, bring them hope. And if you are a bereavement counselor but you don't know the family before the loved one passes away, it's very difficult to help them because they're only going to go to someone they trust, someone they know. And so as a chaplain, I'm able to get to know the patient, the loved one, get to know the family, and I'm able to reach out to them and gain their trust and help them in that regard because the bereavement begins early. And the sooner that we can begin to deal with, the better. And that way I'm able to transition right into working with them, helping them through the grief journey and that bereavement for up to a year after the loved one passes away.
Okay. How do you as a chaplain help to prepare the patient facing the end of life and then also their family members or their loved ones?
One of the important aspects of hospice is to, of course, provide comfort care. And one of the ways we provide comfort care is providing information. People have a fear of the unknown, and with fear comes anxiety and stress. And so as a person is coming into the last stages of their life and to the dying process, the patient has a lot of anxiety of the unknown. So we're able to give them the information they need and the family as well to help them know what could happen or what will likely happen in this process. At the same time, as a chaplain, I'm able to also help them with the unknown of the future, of the afterlife. That's what I do. And so I give them that hope, that understanding. It brings a lot of stress relief, a lot of peace into their life, and that goes a long way toward helping them in the entire process.
Right. When does bereavement begin as it regards the death of a loved one?
That is a good question. A lot of times we think family is not hurting until after the loved one passes away. But to be honest, the grieving process, the journey starts the moment they begin to realize and come to grips with the loss. The soon as they're told that they have cancer that's terminal, they have something that's going to take place in their life that there's going to be a great loss. And so the grieving process can begin then, although it's still not the same as when the loved one passes away. But the loved one who's dying is grieving as well. And so we need to be there for them as well as for the family in the entire journey.
Now, from your experience, how does grief affect the person dying?
Well, it brings a lot of anxiety into their life. It's natural. Again, the unknown, the stress. They don't know how much pain they're going to be in. They don't know what to expect. The more we can come alongside them and educate them, the better. There's going to be times when they're confused. And as the loved one goes further on in the dying process, there will be more and more confusion. And those will sometimes scare the family. They don't understand why their loved one is saying these things or doing these things. And so we're able to help them in that regard as well.
And how important is it to let the grieving process take place?
When a person doesn't allow themselves to grieve, it can really bring depression. The earlier you can start the grieving process, the better, because you're starting the healing process earlier. When you don't grieve as you should, you're holding it in, you're not going through the natural process of that healing. The end result is depression, often anger, bitterness, you have guilt, and all of that leads to anxiety, and it affects every part of your life and your relationships as well.
Right. Is the grieving experience unique to every individual, meaning do people grieve differently?
Oh, very much so. Just as we are each unique before God as His creation, every one of us have a unique background. We have unique relationships, and so no one has the exact experience or grieving experience that someone else might have. And so we have to be careful not to say that we completely understand what someone's going through. We maybe have a good idea, but their grief and what they're experiencing, that journey is very unique to them as an individual.
What might happen, say, initially when someone is going through the grieving process, and then what might they experience after a certain amount of time has gone by?
With the patient or with the family?
Well, either one.
Okay. With the patient, in the beginning, again, there's the unknown, and they're going to begin grieving then.
Right.
They're going to be upset. It's natural that we desire to stay alive.
Right.
And we have the unknown of the future. There's also the grieving for the patient as they have a love for their family, and so often a lot of their grief and stress is for their family. How will my loved one survive without me? How is this going to impact the family? And for the family, there's the loss of the loved one, the one you love. There's the emotional stress of that. But at the same time, you have additional losses. What did that person do in your life? How were you involved with that person? If it's a spouse, you have a lot of losses that take place when you lose your spouse. Maybe there's someone who did maintenance for you. They're your friend, and they're the one who comforts you and encourages you. And so you have all of these losses that take place even in the beginning as you begin to realize what's going to take place.
Now, you were just talking about a loss. What are some of the types of losses that might negatively impact us, but maybe we don't realize it?
When we grieve, one of the reasons it's unique is because of our background. Each one of us have multiple losses, and sometimes we don't stop to think about all the losses we have. Losses come in all kinds of shapes and sizes and forms. For example, you may have a loss in divorce. You may have a loss just from your previous dating relationships. You have losses maybe in the fact you were never able to have children. Maybe with the way unemployment is today, you're looking for work, and over again you've been rejected. And so you've got these losses in your life that add up and influences when we're grieving. Now, if you have some of these losses going on at the same time, now you've got some pretty complex grief going on, and you're going to need some help.
How would you recommend a family member or a friend respond, or even not respond maybe, to a person who's grieving the loss of a loved one?
I usually warn families up front after the loved one's passed away and they're going to have a service. I tell them that when they have the visitation, don't be surprised at what people say.
Okay.
People don't know what to say. That's just a reality. They're sincere, they mean well, but they're going to say some things that are almost rude and they don't even know it. When you come alongside someone who's grieving, don't tell them you know exactly how they feel to begin with. You don't have to talk their ear off. What they need is a good listener. They need someone who will come alongside them and mourn with those who mourn, as the Bible says. Weep with them, mourn with them, show you care, and just have a listening ear. It's also important to not just offer help to them, because if you say, just call me when you need something, it's not going to happen. For one thing, that family isn't thinking clearly. They're going through great turmoil and stress. So if you see something that could be helpful, do it for them. Cut the grass. Don't ask them. And so I think it goes a long way just to reach out to them. That's a great way to do it. Again, be careful not to make comments that could be taken the wrong way. I mean, sometimes people will say, well, you have a death of a child, and they'll say, well, at least God blessed you with more children. Things like that are very harmful and very hurtful. And so we have to be very careful in what we say.
Can times of grief come unexpectedly, even after a season has passed where the grieving person, their loved one has gone on, but can they now all of a sudden maybe experience more grief and not even realize it was still there?
Yes, that's what's difficult about it. You go through various stages of grief, even though you may not go in those stages in exact order as someone else.
Okay.
But the reality is, you are going to get better as time goes on. You will heal, but you will still always have some pain from the loss of that loved one. The reality is that can sometimes flood back all of a sudden. It can just come back. It'll catch you where you have a meltdown in the grocery store.
Right.
You see something that reminds you of your loved one, and it just hits you. All those emotions, all those feelings come rushing back. The good news is that as time goes on, it's less often and it has less impact.
Right.
But you're always going to have a little bit of that grief for that loved one.
And what type of help is available for those dealing with grief?
I would say in your community, start with your own church.
Okay.
Start with your own pastor and what they have set up. If you're not a part of a church, maybe consider it. And again, if you're not a part of any kind of church or ministry, there are a lot of organizations out there at the county level as well as the local level. You can also go to various funeral homes on their websites. They often direct people to various bereavement groups. Hospice groups have bereavement groups, as we do. And so they can go a long way to help you in dealing with your grief. And it's nice to talk to other people as well who are going through some of the same things that you're going through, and you'll find encouragement and strength there.
Right. And why is it important to reach out for help?
Well, because grief is something that's often bigger than us.
Okay.
We're dealing with some great emotions, great losses. And so sometimes it helps just to go and get counsel from someone else. Get guidance, especially early on, because you don't want to make big decisions early on in the process. So you want to make sure you're thinking clearly. And so it helps when you go to somebody else or go to a group where they can give you some guidance, some direction to help you know you're not going crazy, that what you're experiencing is natural. And at the same time, you can establish some relationships that you can then use and have alongside you in the years to come.
How important is it to seek help in helping children to go through the grieving process, particularly younger children?
I know the temptation for adults is to say, I want to protect my child. I don't want to take them to the funeral of grandma or even their mom, sometimes their dad. So the temptation is to say, let's not say anything and maybe just make up a story and then tell them later. The truth is, everyone needs a time to grieve. A child needs that time especially, and they need the support of family around them. So if they're not told till later, they're grieving more in an isolated fashion. It's very important that we all take the time to grieve, and I'm very supportive of memorial services because it begins that healing process. Even with the children, and the children can see how the parents are grieving. They have guidance and direction. They have support, and they need that closure as well as everyone else. And so it's very important. One of the things I do as I'm meeting with families, if I'm going to lead the service for a memorial, I meet with the family first, because not only does it give me an understanding of the individual I'm going to be talking about, the loved one, but it also gives an opportunity for the family to begin that healing process, to sit around the table and begin to reminisce about the loved one, and it goes a long way to begin that healing process.
And how important is it to maybe include children in the planning of that funeral or the memorial service?
Well, to be honest, children have unique ideas, unique perspectives, and there's something beautiful about a memorial service when the child is involved. They might be able to read a poem, they might be able to get up and say something, they might be able to sing or play an instrument, and so they're able to demonstrate their love in a unique way that even from an adult. And it goes a long way to show who that person was that you're honoring. If they were a grandmother, then what better way to show what a great grandmother she was than from the heart of a grandchild.
Well, thank you so much for being on the program today.
Thank you very much. It's good to be here.
We've been speaking with Dennis Richards, and he's the Hillside Hospice chaplain. Our issue has been health, and our topic, grief support. Thank you for viewing Public Report.
The material on this program does not necessarily reflect the views of WWRS.